Most people think that winter skin treatments are just safer. What they don't realize is that the treatments actually work much better for them. Hi, I'm Dr. John Shieh from RejuvaYou Medical. Winter really is the best time to do skin rejuvenation, and it's not just because there's less sun. As summer tanning fades, there's less pigment in the skin competing with treatment energy. There's also less UV-driven inflammation. That means treatments can work deeper, fibroblasts respond better, and collagen builds more efficiently. So winter isn't just safer biologically, it's smarter. Now let me explain what's actually happening inside the skin, because this is the part most people never hear about. During the summer months, your skin is in a very different biological state, even if you never burn. Repeated UV exposure increases melanin production. That's what gives you a tan. But melanin isn't just cosmetic, it absorbs energy. When we perform energy-based treatments like lasers, ultrasound, or radiofrequency, that energy is meant to reach deeper layers of the skin where collagen is produced. When there's more pigment in the surface, a portion of that energy gets absorbed before it ever reaches its target. At the same time, UV exposure creates low-grade chronic inflammation in the skin. You may not see redness, but at a cellular level, inflammatory signals are active. That inflammation interferes with the normal wound healing cascade that we rely on to stimulate collagen. So in summer, skin is more pigmented, more inflamed, and less responsive to controlled stimulation. This brings us to fibroblasts. Fibroblasts are the cells responsible for producing collagen and elastin. They are the engine of skin rejuvenation. UV exposure has been shown to suppress fibroblast activity and increase enzymes that break down collagen. In other words, summer sun slows collagen production and accelerates collagen breakdown. When UV exposure drops in the winter, that suppression lifts. Fibroblasts regain responsiveness and they respond more predictably to stimulation. This is why treatments done in the winter often produce better firmness, better texture, and more consistent results. Not because the treatment is different, but because the skin biology is different. When UV exposure drops in the winter, melanin levels gradually decrease. Background inflammation settles down and fibroblast signaling improves. This allows energy-based treatments like ultrasound and radiofrequency and lasers to trigger a cleaner, more productive collagen-building response. It also often allows us to treat at more effective settings than we safely can when the skin is heavily pigmented. That's why our winter is the most productive season for true skin rejuvenation. There's one more important piece. Collagen doesn't rebuild in weeks, it rebuilds over months. When treatments are done in the winter, that collagen remodeling matures in spring and early summer when people want to look their best. That's proactive biology, not reactive repair. This understanding of skin biology is what guides how we treat patients at RejuvaYou. Winter isn't just safer, it's biologically better.